Hair loss, present reality, practical options, and future hope. Introduction. Hair loss is one of the most emotionally sensitive changes a person can experience. It often begins quietly, a few strands on the pillow, hair in the bathroom drain, a slightly widening parting, a slowly receding hairline. But what follows is not just a cosmetic concern. It becomes worry, comparison, self-consciousness, and sometimes deep sadness. Many teenagers and young adults today are affected. They begin to ask, am I going bald? Will I lose my confidence? Will others judge me? Is there any hope? For some, hair loss becomes more than appearance. It becomes identity. Scientific studies confirm this emotional impact. Research published in the Journal of the American Academy of Dermatology has shown that androgenetic alopecia significantly affects self-esteem and confidence. Cash TF, Journal of the American Academy of Dermatology, 1999. Another study in the British Medical Journal demonstrated that hair loss is associated with anxiety, depression, and reduced quality of life. Hunt and McHale, BMJ, 2005. But here is an important truth. Hair loss is extremely common. It affects a large percentage of men, many women, and increasingly young adults. And yet, millions live full, confident, successful lives with thinning or bald hair. So this talk is not about fear. It is about clarity, options, and hope. We will explore why hair loss happens, what works today, natural and medical options, psychological coping and acceptance, and the exciting future of hair science. The goal is not just regrowth. The goal is calm, understanding, and empowerment. Section 1. Understanding hair loss. Hair loss is usually not sudden destruction. It is gradual follicle miniaturization. Hair follicles do not die immediately. They shrink slowly. Hair becomes thinner. Growth phase shortens. Eventually, very fine hair appears. This process is driven mainly by DHT, dihydrotestosterone. Scientific research shows DHT causes follicle miniaturization in genetically sensitive individuals. Randall V.A., Dermatologic Therapy, 2008. This is why hair loss is often reversible early. If we intervene early, follicles can recover. If delayed, follicles may become dormant. Hair loss in teenagers is often reversible, especially when addressed early. Common causes include genetic sensitivity to DHT, stress-related shedding, nutritional deficiencies, inflammation, hormonal changes, aging, scalp health issues. Different causes need different solutions. Section 2. Psychological impact. Hair loss affects self-image. It affects social confidence. It affects relationships. It affects anxiety levels. Studies show young men with hair loss experience increased social anxiety and lower self-esteem. Alfonso M., Journal of the American Academy of Dermatology, 2005. But we must also remember something equally important. Many successful people are bald. Many confident individuals have thinning hair. Confidence comes from personality, presence, calmness. Hair is only one part of identity. So we must balance hope for improvement and acceptance if needed. This balance reduces suffering. Section 3. Present non-medical practices. Let us begin with simple supportive practices. These improve scalp health. Scalp massage. A clinical study demonstrated that standardized scalp massage increased hair thickness after 24 weeks. Koyama et al. E-Plasty, 2016. Massage improves circulation, reduces scalp tension, supports follicles. Oils. Rosemary oil has scientific evidence. A randomized study compared rosemary oil to minoxidil. After 6 months, both groups showed similar improvement. Panahi Y. Skin Med, 2015. Castor oil, coconut oil, and olive oil help by reducing inflammation, improving scalp barrier, reducing breakage. Stress reduction. Stress affects hair growth. Research shows stress hormones push hair follicles into resting phase. ARC-PC, American Journal of Pathology, 2003. Meditation reduces cortisol, improves circulation, stabilizes hair cycle. Nutrition. Hair follicles are metabolically active. Important nutrients include protein, zinc, iron, vitamin D, omega-3. Vitamin D deficiency has been linked with androgenetic alopecia. Rashid H., Dermatologic Therapy, 2013. Adequate hydration also supports scalp and follicle health. Section 4. Local applications. Now we move to topical treatments. First, minoxidil. A randomized clinical trial showed 5% minoxidil significantly improved hair growth compared to placebo. Olson E.A., Journal of the American Academy of Dermatology, 2002. Minoxidil works by increasing blood flow, prolonging growth phase. Second, topical finasteride. Topical finasteride reduces scalp DHT with minimal systemic absorption. Casarini M., Journal of Clinical Pharmacology, 2014. Third, adenosine. Adenosine promotes hair growth and increases hair density. Ura H., Journal of Dermatological Science, 2008. Fourth, caffeine. Caffeine stimulates hair follicle growth in vitro. Fisher T.W., International Journal of Dermatology, 2007. These treatments slow hair loss, improve density, work best early. Section 5. Oral options. When hair loss progresses, oral options may be considered. Finasteride blocks DHT. Clinical trials show finasteride improves hair growth in androgenetic alopecia. Kaufman K.D., Journal of the American Academy of Dermatology, 1998. It is effective but requires informed decision. Section 6. Supplements. Supplements help if deficiency exists. Vitamin D, zinc, iron, omega-3, saw palmetto. Saw palmetto has mild DHT blocking effect. Rossi A., Journal of Alternative Complementary Medicine, 2012. Supplements are supportive, not miracle. Section 7. Procedural options. Hair transplant redistributes existing hair, but does not create new follicles. It provides permanent hair from donor area. Bernstein R.M., Dermatologic Clinics, 1999. PRP, platelet-rich plasma. PRP injections improve hair density. Gentile P. Stem cells translational medicine, 2015. Microneedling stimulates growth factors. These are intermediate options. Common questions. People ask about hair loss. At this stage, many people begin to ask practical questions. Let us address these common concerns one by one. Does daily washing cause hair fall? No, washing does not cause hair loss. Loose hairs fall during washing. They were already shedding. In fact, gentle regular washing keeps scalp healthy and reduces inflammation. Use mild shampoo. Does adenosine help hair growth? Yes, adenosine can help. Adenosine promotes hair growth by prolonging the growth phase of hair follicles. Studies show adenosine increases hair density and thickness. Fukuoka H., Journal of Dermatology, 2012. It is not as strong as finasteride, but it is safe and supportive, especially in early thinning. Do sulfur supplements help hair? Hair contains sulfur-rich amino acids, such as cysteine and methionine. These support hair structure. However, if diet already contains adequate protein, additional sulfur supplements may not provide extra benefit. They may help only in poor nutrition, brittle hair, low protein intake. Routine use is usually not necessary. Does tap water chlorine affect hair? Yes, chlorine affects the hair shaft. Chlorine removes natural oils, causes dryness, increases breakage. This can make hair appear thinner. But chlorine usually does not damage hair follicles directly, so it causes breakage, not true baldness. Does fluoride in water cause hair loss? Current evidence is weak. Fluoride may slightly dry scalp in some individuals, but there is no strong evidence that fluoride causes baldness. Most issues are due to hard water, chlorine, mineral buildup. How to do scalp massage anytime, anywhere. This is simple. No oil needed. No cost, no equipment. Use fingertips. Place them on scalp. Move scalp over skull. Small circular motion. Do not scratch. Do not rub hair. 3 to 5 minutes daily is enough. A clinical study showed scalp massage increased hair thickness. Koyama T. E-Plasty, 2016. You can do this while sitting watching TV before sleep during meditation. Is hair transplant the only option? No, hair transplant is one option. Other options include topical treatments, oral medications, PRP, microneedling, lifestyle support. Hair transplant is considered when bald areas are significant. Is hair transplant permanent? Transplanted hair is usually permanent because donor hair is resistant to DHT. However, original hair may continue thinning, so transplant does not stop future hair loss. Can chemotherapy cause hair fall? Yes. Chemotherapy targets rapidly dividing cells. Hair follicles divide rapidly, so hair sheds. This is called anagen effluvium. The good news, hair usually regrows after chemotherapy. Does daily washing cause hair fall? No, washing does not cause hair loss. Loose hairs fall during washing. They were already shedding. However, harsh shampoo may cause dryness and breakage. Use mild shampoo. Does oiling hair help? Oiling helps by reducing dryness, reducing breakage, improving scalp barrier. Massage improves circulation. Oil supports scalp health. But oil alone does not regrow hair. Which drugs may cause hair fall? Some medications can cause shedding. These include chemotherapy drugs, antidepressants, blood thinners, retinoids, beta blockers, thyroid medications. Hair usually regrows after stopping the drug. Hormonal influences in males. Main hormone, DHT. DHT shrinks follicles. This causes male pattern baldness. Genetics determines sensitivity. Hormonal influences in females. Common causes: PCOS, thyroid imbalance, post-pregnancy, menopause. These cause diffuse thinning, often reversible. Chemicals that affect hair. Frequent exposure to hair dyes, bleaching agents, harsh shampoos, heat styling. These damage hair shaft, cause breakage. Recommended diet. Hair needs protein, healthy fats, iron, zinc, vitamin D, omega-3. Helpful foods: eggs, nuts, seeds, green vegetables, pulses, fish. Diet supports hair health. So we see that many concerns about hair loss have clear explanations. Understanding reduces fear. Knowledge brings calm. And from here, we move to the most hopeful part: the future of hair restoration. Section 8. Future Hope. Hair cloning, stem cell therapy, exosome therapy. Jehoda C.A., Nature, 1999. Gentile P., International Journal of Molecular Sciences, 2017. Kim Y.S., Stem Cell Research and Therapy, 2020. Future treatments may restore hair. This gives real hope. Section 9. Acceptance. Even with all treatments, some thinning may remain. Acceptance is not defeat. It is freedom. Confidence comes from presence. Hair is not identity. Closing. Conclusion. Hair loss can feel overwhelming, but today we have understanding options, supportive practices, medical treatments, future hope, and most importantly, your value is not determined by hair. You are not defined by your hairline. You are defined by your presence, clarity, kindness, and strength. There is hope. There are options. There is time. And even beyond all this, there is acceptance. Confidence does not grow from hair. It grows from understanding. And understanding brings peace. Thank you. Founder, Holistic Wellness Foundation. Imphal, healing beyond boundaries.